have the Ayush coverage at par with other treatments in their insurance. But when it comes to actual execution, we are facing from our customers a lot of challenges around the claim settlement. So in insurance, you will all appreciate that when a person buys health insurance policies, they pay premium, and as sir rightly said in the morning, the whole question is around whether my claim will be paid or not. So we see that in case of Ayush coverages, we need a lot of clarity amongst the insurance companies as well as amongst all the Ayush hospitals and the daycare centers. So I have a small presentation. You know, a detailed survey has been carried out from the customers who are visiting Policy Bazaar on regular basis, and this is exactly what they have to say on the Ayush coverage. So can I have a presentation, please? It's just a 2-page presentation. So we have 18 million customers who generally, come to our platform on a regular basis, and specifically they buy life insurance and health insurance. They're all retail customers. So when the survey was conducted on the health insurance policies, that what exactly they are looking forward to.
Then you should tell them that I want to know because I want to help you, so that you don't spend money and we can help you in getting a claim settled through your insurance cover.
Okay.
Now I want to explain you one more thing which the regulator has done in favor of hospitals who are also not empaneled. Even if you are not empaneled and you treat a patient who has got insurance cover,
Okay.
that patient can go for reimbursement. And also now the government is saying, the regulator is saying, you heard Mr. Pankaj Sharma, he said cashless anywhere.
Anyway, cashless, yeah.
The regulator is saying whether the hospital is empaneled or not empaneled. If somebody is coming with an insurance policy, you can go to that insurance company and ask for cashless facility for that person.
Okay.
Am I clear or not?
Yes,
Pankaj,
yes.
can you clarify? Am I right or wrong?
Yes, thank you.
Only thing is the hospital should be eligible for getting the cashless. That is the only requirement for anywhere cashless as well.
Okay.
You get my point?
Yeah, yes.
So when you go back to Hyderabad,
Yes.
and I am based in Hyderabad, if you have any problem, call me. I am available 24/7.
Thank you, sir. Thank
Okay,
you, definitely.
and
I'll
you will see that anybody who comes to you with an insurance cover, it is nothing to do with 100 rupees, 140 rupees and 10,000 rupees. No. If he is having an insurance cover, he is eligible for a
Okay.
cashless treatment.
Yeah.
Okay?
Definitely. Thank you.
Start your experiment from today.
Definitely.
Okay? Thank you. Any other person? Any questions? So Policy Bazaar, Rajiv ji.
Just to add, madam, to your question, on the second part of your question, you asked whether you could charge a different rate for people who can afford, right? So typically people who are coming to a government hospital who are wanting a higher grade of service, if you have a different category of rooms with which you are giving it slightly different, a pay ward kind of thing, That then you could empanel under your overall thing also a different category of rooms and then explore that. In which case you're able to charge beyond your 140 rupees. Thanks.
Very good. Excellent. Madam, I have one question for you. I have one question. You see this study which you revealed. So can you share that study with us also? Because
Yes, sir.
the first thing is I would like to know what was your universe, how many people you contacted, what was the
Absolutely,
profile
sir.
of those people,
Absolutely,
and how you came to this.
Yes,
Because
sir.
this recommendation, if you give it to the ministry,
Yes, sir.
it will help us in our policy making decisions.
100%.
Okay,
sir.
that
Yes.
is number one. Number two, what we also want from people like you, and that is why in this forum, we have requested the intermediaries to come.
Yes, sir.
And also that is, we got encouraged because member distribution was willing to come and attend this event as the chief guest. So we wanted
So we
intermediaries.
are grateful to to Pathi sir, because he has given us this platform to share our experience with all of you.
Correct.
Because
So-
Policy Bazaar being such a big platform,
Correct.
we can give you real consumer insights.
So before you take your flight to go back,
Yes,
because
sir.
you are in a hurry to go, my request to you is that Policy Bazaar should start certain initiatives as an intermediary
Yes, sir.
to promote Ayush treatment in the country.
Yeah. I will give that feedback to my management, sir.
That is number one.
Yeah.
That is number one.
Yeah.
Number two, we also want to know from you,
Yes, sir.
like you did this study, we want the report of this study, the whole details of the study, so that we can justify to the government that this study was done in a scientific manner and
Yeah,
it has been vetted in a proper way.
Mm-hmm.
Now, if there are some doubts on that, then we will make it better
Yeah.
for the
Sir,
future.
I will definitely ask my concerned business team, because he was supposed to come. And
But doesn't matter. Doesn't
yeah.
matter. You have come.
Yeah, yeah.
So once you have come, so my only request now is, from tomorrow onwards, you should create a database of all Ayush hospitals in this country.
Okay.
You should try to create that
Yeah.
data. I'm just requesting you.
Yeah,
because you are
absolutely,
an intermediary.
Yes, sir.
And what we also want is, how do we use that data to the advantage of the patients who go to Ayush hospitals, who don't have an insurance cover, to go and get an insurance cover in a most affordable manner.
Sure, sir.
So we can start talking on those terms.
Absolutely, sir.
Okay, so this is what my request was. So before she goes to take her flight, and that's why we brought her in the beginning. Anybody has got any more questions to ask her? Yes, yes, please. Mic here, please.
Sir, I am Dr. Kamalakan from Pondicherry, sir. I am working in Karikalam Community Health Center as well as in Ayush Hospital, Pondicherry. So, in Pondicherry, Ayushman Bharat,
Slowly.
in
Speak
Pondicherry,
slowly. You don't have to take a flight, ne?
no, sir.
Slowly. I can't understand what you say.
Okay, usually my slight lips. We have Ayushman Bharat in Pondicherry, sir. So, people are claiming, our hospital is claiming money from Ayushman Bharat. Will it be applicable to Ayush also? Very simple, sir.
As on today, it is not applicable.
Okay.
But efforts are going on to bring Ayurveda in Ayushman Bharat scheme. Once it is coming, it will be announced publicly by the government.
Thank you, sir. Thank you.
Very good. Any other person? Yes.
I have been waiting long to ask you. First of all, I kudos to the Siddha fraternity for giving a place in the heart to whole of Ayush. In this regard, Siddha is best. Anyway, sir, I want to put my question to the Ministry of Ayush. Like, for instance, a person is there and he has got an emergency and he is going to a corporate level hospital where he is being treated. For instance, maybe cardiac or any other thing. And after getting treated there, he wants to recuperate his health through Ayush. So is there any way where you can bring both Ayush and allopathy in one? And question to Ministry of Ayush can be there. Can we integrate allopathy in Ayush throughout the country?
I think Rajiv Vasudevan can answer this. He is already running part of the integrated Ayush hospital and he will share his experience. It's not a question of ministry's decision. It's the field experience. Dr. Rajiv will share.
I think your question is more philosophical, but with specific to the insurance aspect, under one policy, the two treatments being given simultaneously will not be covered as of now, is the way it is. To give a specific answer. But somebody who is taken allopathy treatment and subsequently is for that condition or another condition goes to an Ayurveda facility within the same building, it is still permitted. So under IRDA guidelines, a co-located facility is allowed. An Ayush facility can be within an allopathy hospital and still it is approved. So to your larger point, integration is happening across the country. There are many, many major hospital groups who are open to the idea of having a good quality Ayush facility inside homeopathy, Siddha, Ayurveda, etc. So that trend is there. I hope I am answering broadly your question.
Yes, sir. My thesis also was this
Yeah.
when I was in Bitspill and Yumfield.
Okay.
Integrating allopathic and Ayush for the better health system. Thank you very much.
Thank you.
I'm going to say goodbye to her or what?
Yes. So just I have one more question. So just last one question.
Yeah, okay, go ahead.
Last question.
Go ahead.
So, like this was a very good session. We had good insights over this. Mike,
Yeah, we can hear you.
Is it audible?
Yeah, audible.
So, like a beginner, just I want like as a beginner, like my first step I'm taking. I want like my question is. So, madam has mentioned about like because of unavailability of the required documents, there's claims could be cancelled.
Rejected, yeah.
And sir had also told, Pankaj sir also told, hospital eligibility is also there. If you could give us a insight about hospital eligibility and also required document as on a basis, it will be easy for us also. And
Yeah.
we don't have a proper same set of documents kept in all the hospital, followed in all the hospital. If you could give us an idea, we could all follow the same.
No, so what my contention is that we will have another session for that. You know, I will specifically invite people like you all from the hospitals because that is the whole objective. And of course, the insurance company representative Ashish ji will talk now. He will explain what all documentations are required and all that. Then your question, he will try to answer in his presentation.
Yeah,
Very good question.
Yes,
Thank
sir,
you.
that will be the first step for all of us. to
Yes,
start
yes.
with.
Thank you. That's why we have invited him to speak
Yes.
in
Thank
today's session.
Thank you, sir.
Okay. So let's
May I request, with your permission, sir, can be your fell statement. So may I request our director, National Institute of Siddha, to fell state Ms. Deepthi Rastogi. Thank you, ma'am. Over to the chairman of the panel session.
What is the secret gift you are giving us? It's a secret, sir. You are being partial. You are being partial. Very good. Thank you very much.
Thank you. Next is this IIBA, है ना?
So the IIB person is there online? Hello? Yes. Next speaker is there online? Okay. Get him on the line.
The next presentation will be online on the subject of recent trends in Ayush insurance claims vis-a-vis conventional healthcare sector. It will be done by Sri Anil Kalyanam from IIBI, Hyderabad. It will be an online session.
Please connect.
IIB is Insurance Information Bureau.
Go ahead. Not audible. Can't hear.
So you can have your questions ready, I think, at the end of this slide. But I hope most of your questions will be answered, as other presenters have also tried to do so. I distinctly remember one question asked by ma'am there, that she belonged to a government institution. As far as Oriental Insurance is concerned, I can tell you that we have a board approved policy wherein we are preferring government Ayush hospitals for empanelment. So that is approved by board, wherein we are giving preference to the government institutions. So you can apply. We have, as I go ahead in the presentation, we have generic email IDs published on our website. You can simply apply and our team will get back to you in respective areas. This area, as sir also said, that we have distributed the country into 4 zones, and we have decided a flag insurer to help the providers in getting empaneled. So United India takes care of the southern region, but anybody who is based in northern India and belongs to a government institution, please don't hesitate to get in touch with us. We will definitely assist you with the empanelment. So I'll start my presentation. Most of aspects have been spoken about by various speakers and clinicians on this dais, but I'll try to touch on certain points which are of prime importance and are very basic in nature. See, if you see, what is the benefit of promoting cashless facility for Ayush? There are 3 stakeholders primarily. One is policyholder, second is the Ayush providers, and third are the insurance companies. So for policyholders, there is no out-of-pocket expense and improved access to the quality healthcare and easy claim settlement. For Ayush providers, of course, it's faster payment and lesser hassle administratively. Increased number of patients who will go for Ayush treatments if there is a payer. And for insurance companies, once we have decided on providing holistic cover under our insurance policies. So if we can offer cashless services, it improves customer satisfaction and streamlined claim process and reduced overhead costs. These are the basic aspects which every one of us is aware of, that cashless facility can render. And that is why I'll stress on the point that as far as public sector general insurance companies are concerned, we are with open arms for empanelment of Ayush providers. We have already provided cover to all kind of Ayush facilities in our policies. So as far as our companies are concerned, I can vouch that we have no prejudice as far as Ayush is concerned. Now, basic steps in a cashless processing, many speakers have spoken. There is a pre-authorization request wherein an insured goes to a hospital. The clinic submits a pre-authorization request giving the basic details of the hospitalization or the ailment. Then the insurance company reviews the request and approves the cashless treatment. Then there is treatment and documentation, the actual treatment rendered, medical reports, invoices, and the progression of the disease, claim submission wherein the patient is discharged, the entire claim set is submitted to the insurance company or their servicing TPAs who are settling the claim, and finally the claim verification and settlement. These 4 basic steps are there for any kind of cashless settlement, be it an allopathic or an Ayush claim is concerned. Now, where the challenge comes. What are the challenges in cashless processing of Ayush claims as of now? See, I was just speaking to Vasudevanji that, allopathic system of medicine has been interacting with insurance for last 70 years and still we are developing STGs and SOPs. Still we are trying to, reduce the discharge period, discharge time from the hospital. Still we are, trying to come on a common ground to ensure that customer satisfaction can be improved, and still there are disputes between insurance companies and allopathic providers. As far as Ayush is concerned, this is definitely the most ancient paddhati for treatment, but it is most nascent for insurance ecosystem. So please bear with us for some time at least. So we are progressing much faster than we did for allopathy. and we are progressing with the help of these gentlemen in the right direction for sure. The three challenges which we have noticed as an insurance company in processing Ayush claims in a cashless mode are awareness and education, which, you know, I think Ministry of Ayush and all the associated subset of people are doing wonderfully well by organizing such workshops with all the stakeholders in presence. There is definitely lack of awareness amongst general public regarding Ayush coverage, what is covered, what is not covered. So we are also making our efforts to ensure that it is percolated to every policy holder that Ayush is covered up to such and such extent, and what is not covered as well. That is also very important. That also we are explicitly mentioning nowadays in our policy documents. So I'll request the providers also to educate all the patients who approach you that now Ayush is covered in insurance policies. Now that coverage may depend from from insurer to insurer, but at least, you know, now all the insurers are honoring Ayush claims, and they are extending the coverage to for Ayush treatments. Second is the lack of awareness amongst Ayush providers regarding the same thing, that whether it is covered, if it is covered, then what is not covered. As some of my colleagues were saying that preventive care, whether the preventive care or whether the one visit or whether the consultations are covered or not, those are not covered for allopathic system as well. So there is something, as of now in Indian system of insurance, most of the policies are indemnity based policies or hospitalization policies. There are covers which are, you know, which are extensive, but in general the policies are hospitalization based policies. So that is not covered for that as well. So you also have to understand, as we go ahead and we want to make Ayush more extensive, you also have to understand the policies of insurance companies. Second is lack of standardization in protocol and documentation. As I said, we have started standardization at various levels, be it diagnosis, be it the treatment process, or be it the discharge summaries. These are three basic documents in treatment of a patient, but still work is to be done. So there is definitely a discourse amongst various stakeholders that, you know, how to standardize these documents. I'll present I've tried to standardize one document which will help you as well as insurance companies to struck a chord and, you know, arrive at a common level wherein, you know, if you regularly present insurance company with the details of the patient in such manner, I think the hassles will be much lesser. The third challenge which we feel is the limited network of Ayush providers. This is natural because Ayush coverage has recently started, so the network is developing, and from a network of 100 hospitals, already more than 500 Ayush providers are empaneled across the nation. So it will grow in due course of time, but till such time, you know, these are the challenges which are there for processing of claims in a cashless mode. What are the strategies we believe in for overcoming these challenges? One is awareness campaigns, as I said. Second is standardization of documents, which we have discussed and we are discussing at various levels. And third is the integration of insurers with Ayush providers for this cashless thing. So we are developing network. As I said, Oriental Insurance has a dedicated networking page wherein we are doing empanelment round the year. In earlier times, we did had a window of time wherein you could apply and then, you know, your claims, your application would have been processed. Now it is round the clock, round the year. Next slide is on for any payer or for any insurance company, the basic expectation for cashless processing is that patient's health record should explicitly mention the need for inpatient hospitalization, the diagnostic parameters confirming the disease, whether the IPD, OPD or daycare procedure, number of days of stay in a hospital, treatment plan, surgical or medical, and diagnostic parameters confirming prognosis that treatment has been rendered. Now these are the things which are required for any claim, be it any system of medicine. And the template which I am going to share with you reasonably elucidates and covers all these points. When you are treating a patient, you should be in a reasonable position to give these details to the insurance company. And if you can standardize this in your practice, day-to-day practice, your cashless claims will be, much smoother as, with any insurance company. Second is the details of the healthcare provider. As Pankaj ji has also said, the definition clearly mentions who qualifies as a Ayush provider. Third is the policy detail. Fourth is the medical receipts and invoices. For these invoices also, there is a standard format prescribed by the regulator, wherein the surgeon charges or the doctor charges, the room rent and the associated expenses, they are columned, and they can be provided to the insurance company for settlement of the bills. Now coming to regulator, these are the recent guidelines issued by regulator with respect to Ayush. One is, as everybody has spoken, cashless facility has been opened across all hospitals, whether a network hospital or a non-network hospital. If it's a network hospital, or it will be done through cashless mode. If it is a non-network hospital, you can still apply under the initiative of 100% cashless. But of course, you have to intimate 48 hours prior to the hospitalization, and it is the insurance company's prerogative to accept or not, depending on the eligibility of the hospital. Second is, the regulator has directed everyone to have a board approved policy to treat Ayush treatments at par with other treatments, and quality parameters to be mentioned for empanelment of Ayush hospital. Third is, all existing insurance products are to be modified to ensure that there are no sublimits for Ayush, and there is a push to settle Ayush claims on cashless mode. Insurers have also been directed to develop SOPs for treatments of Ayush and engage with the core committee on insurance for implementation of these guidelines. Now, what has been our contribution as far as Oriental Insurance is concerned, that we have a board approved policy for enrollment of Ayush providers. I repeat, in this board approved policy, we have explicitly mentioned that government backed hospitals or charitable institutions will get a preference. So second is, we have a board approved policy on basic infrastructural and quality parameters for Ayush providers. We have a board approved policy on clinical and treatment protocols for Ayush, and we have approved the billing formats as per IRDA guidelines in the board. Second is, our all health insurance products stands modified to incorporate Ayush coverage without any sublimits as such. There is one important point I want to mention here is that, many a times we do a comparison of allopathic versus Ayurvedic. I want to tell you that in most of our insurance products, there are sublimits for allopathic treatments, but there are no sublimits for Ayush as on date. So this is something, which the point is missed most of the times, and, insurers are kind of blamed for it, that, we are not doing enough for Ayush. You can check any insurer's policy. As far as Oriental Insurance is concerned, I can guarantee you that Ayush does not have sublimits, and allopathy treatments do have sublimits. To name a few, I can tell you cataract, total knee replacement, total hip replacement, cholecystectomy, hysterectomy. So there are many more sublimits for allopathic treatments, but there are no sublimits for Ayush as of now. Third is that we do have a dedicated networking page, as I said, on our corporate website, inviting Ayush providers, specifically mentioning that we do invite Ayush providers to register for empanelment on our generic email ID. As I said, Oriental Insurance take care of northern part of India. We will be happy to receive your application and cater to your request of empanelment as soon as possible, subject to, fulfilling of the minimum benchmarks which have been approved by our board. Our General Manager Health, Meera Parthasarthi ma'am, has been kind enough to nominate me and share our perspective here amongst Ayush providers and such dignitaries. She is a part of core committee of Ayush, and she has been contributing towards the promotion of Ayush and finalizing many papers with respect to different disciplines related to Ayush. all servicing TPAs have been explicitly sensitized by us to ensure that Ayush claims are treated strictly as per regulations in place, and there is no message to any of the intermediary that we do want any kind of cost cutting or any kind of prejudice against a particular kind of claim. So we have been issuing guidelines as well as emails on this subject that Ayush claims must be treated at par with any other claim. So these are few things which Oriental Insurance has been doing in last couple of years and as far as Ayush is concerned. So this was my presentation as far as Ayushman is concerned. So I'll just want to share one template wherein I request all the concerned people also to circulate it with the Ayush providers. I think that will help, sir, for every Ayush provider to